indeed, I'm in Bucharest. The Russian troops are 40 kilometers for our borders in the east. Um, According to the United Nations, as you all know, 500,000 people left Ukraine in only 4 days. 4 days. If we have to apply the incidence of the FH, 1 out of 250, actually 2,000 of these 500,000 migrants could be FH patients. In the best case scenario, 20 of the 2,000 are diagnosed. They know about their disease. But we have no idea about their potential treatments if they have interrupt the treatments and so on. 500,000 migrants and counting. Almost is the population of a town like Basel in Switzerland that actually moved and disappeared in only 4 days. The war in Ukraine already disrupted the life of people in Ukraine, but as well in Russia. And the FH Europe statement, it's a very, very good one. And FH Europe is one of the first civil society organization in Europe having a statement on this situation, on this war in Ukraine. But the war as well disrupted the neighboring countries like ours, like Romania, like Poland, Hungary, Moldavia, and Slovakia. But as well the Europe in general, because most of these migrants have the final destination in a Western Europe member states. The Ukraine war put already an increased pressure on the health system in the region. And this is mainly because of pandemic. Most of the countries in the region didn't exit yet from the fifth wave of the pandemic. We know that the vaccination rate is low and the capacity of the health system is as well low compared to the Western European countries. So this war in Ukraine as well elevate the risk of COVID-19 relapse due to migration. People are moving between countries and as well the virus. And it's more difficult to have the proper surveillance of the virus in this context. We know for 100 years from the Spanish flu pandemic that is a bad idea to overlap a pandemic and the war, because the third and the fourth wave of the pandemic 100 years ago was actually due to the war and the movement of the troops between a country or another. The disruption of the health system in my country, in other neighboring country, it's a reality as well for the chronic disease patients who currently experience an access to care that is still a big issue, is still a big problem. Because pandemic didn't end, the chronic disease patients facing many challenges to have access to care. And imagine this wave of migrants, some of them elderly people, in need, in search for healthcare. From the EU perspective, I had some discussions last week with some people from the Commission, from the European Commission, and they said, all of them said that they should now prioritize the humanitarian crisis in Ukraine. And that means that actually we should wait for our topics to become again of interest, to become mainstream, as we have seen actually at the beginning of the pandemic, when all the EU institutions were focused on the emergency. So we we have to start again, not just from the beginning, but to start again to put our topic of interest on the agenda. The old, before the pandemic normal, the old normal, and I think as well the new post-pandemic normal, I think are both already history. And we have to cope now with a new normal. And this new normal is actually stratified on multiple layers. We have the war crisis, I think is the most important one, as well the pandemic crisis, the energy crisis, the economic crisis, and many analysts expect a potential food crisis in the near future. So it's complicated. Take a look to the chat. Take a look to the chat now. I just add there a photo, a photography taken by a friend of mine, Alex Nicodim, who is a freelance photographer. And the photo, the picture was taken at the Romanian-Ukrainian border. I think we simply cannot imagine a future in which kids will paint guns, as we cannot imagine a future where newborn and pediatric screening for FH will remain both optional, as it is now. So this new context, new normal is more complex, it's fast moving, and we have to adapt. I think it's important to communicate with empathy and hope. And I think it's our task to continue to explain the science, and it's so important to have with us Professor Koshray today. And to prove that actually the world is not waiting for the crisis, for the war to end in order to move forward with the science and to provide to other people in need the diagnosis tools and the treatment that can save their lives or improve the quality of life. So I think it's crucial, in a conclusion, it's crucial to not to fight, but to defend. First of all, to defend our fundamental values and how our humanity, and to be able to left no one behind.
Marius, thank you so much. I think your perspective is a wake-up call, an important message to make sure that the reality that's happening, we need to work even harder, and we are far more motivated to make sure that we deliver on our mission and promise